Welcome to Module 3. This module will offer an overview of the most common billing errors made by participating nursing facilities and practitioners across the country during chart reviews conducted by CMS evaluators in 2017, including missing documentation showing the resident met the clinical criteria, no evidence of a practitioner confirmation visit or evidence of documentation by practitioner visit occurred outside of the window for the acute confirmation condition. Some examples of clinical criteria not met include missing documentation showing resident met clinical criteria threshold under the program requirements. If present, documentation of clinical criteria did not meet the clinical threshold. Examples of billing criteria not met include no evidence of practitioner confirmation visit or no evidence of documentation by practitioner. Practitioner visit was for a follow-up visit and not an acute visit. Practitioner visit was unrelated to one of the 6 conditions. Practitioner visit occurred outside of the window for the acute confirmation condition. A resident must meet the clinical criteria required under this program for a facility and practitioner to bill under the program. Common mistakes found during chart reviews included clinical threshold criteria was not met or documentation of criteria did not meet the clinical threshold. Missing documentation showing the resident met criteria. In these instances, nursing facilities did not properly document a resident's change in condition and clearly demonstrate in the medical record that the resident met the clinical criteria threshold for one of the 6 conditions. The use of SBAR or other structured tools by the nursing facility staff to capture a change in condition is required under the program. For a nursing facility or practitioner to bill one of the 6 conditions, a nursing facility is required to have a practitioner visit the resident in person and confirm the condition within 2 days of the outset of the acute change in condition. Confirmation is defined by CMS as the confirmation of the qualifying diagnosis and the prescription of treatment by an attending practitioner at the facility. This confirmation must include an in-person evaluation by a practitioner or a qualifying telemedicine assessment by the end of the 2nd day after a change in condition. This evaluation must be documented in the resident's medical record. The 4th day is the last day a facility is allowed to have a practitioner confirm a resident for a specific acute change in condition. Some common mistakes found with the practitioner confirmation visit include no evidence of practitioner confirmation visit, practitioner documentation. Nurse reviewers were unable to locate practitioner documentation. Practitioner signature on order or lab in lieu of documentation is not accepted. Practitioner visit was for a follow-up visit and not acute visit. CMS will not accept follow-up documentation unless practitioner identifies acute episode at time of a follow-up visit. Practitioner visit was unrelated to one of the 6 conditions. There were instances where nursing facilities billed for one condition, for example CHF, and the practitioner ruled out the condition. There were also instances where practitioner documentation did not contain evidence of the acute condition billed for. You have now completed Module 3 of the ATOP 2 Billing for Practitioners course, Common Billing Mistakes. Click below to test your knowledge of the most common billing errors before the conclusion of this course.